So if you could tell doctors, just any type of doctor, kind of one thing to improve their communication with senior patients, what would you tell them?
Listen first. I would say try to eliminate the time pressure if you can, and in your first 5 minutes, truly listen. Listen to the person that's coming in. Gauge where they are in terms of their knowledge, their intellectual capacity at that point, whether they're diminished or not. Before you go say, oh yeah, I see that you're saying your hip is bothering you. Spend that first 5 minutes with the patient and do what you are supposed to do, is learn about the patient, even though you have that time constraint to get them in and get them out. That, I think, is the most important thing.
What have your experiences been with doctors kind of after you passed that, arbitrary threshold and kind of became a senior citizen patient? And do you think they kind of treated you differently, after that point than they did before that point?
So what started this with me being more careful about going to see a doctor was my mother-in-law, who was living in Pennsylvania at the time and I was up here. Her first encounters usually were not the best. They would ask her questions and she didn't have the answers. They would lose patience, and it was that kind of process. So the problem was we're on the phone or trying to figure out what's happening with her and the doctors. So the old telephone game comes in because she couldn't remember exactly what the doctor said and we couldn't get a straight answer. And at that point we started making the trips to Pennsylvania to go to the doctor with her and schedule a bunch of appointments together. The net of that was that's when the light went on and said, you need someone to help you when you go in.
Like directly there with you?
Yeah, someone has to be there to help you ask the questions and to help you understand when you leave what we're trying to achieve with your health.
Right. Okay. So do you have any advice for a senior patient who feels rushed or feels kind of pressured to be rushed at a doctor, or doesn't really feel like they can properly ask or clarify all the things they want to ask the doctor?
Stand up for yourself. There was a doctor who was considered living the God complex because she was a good surgeon for eye surgery. And when I went to her and I brought my wife as an advocate, my wife was taking notes. And after I started to ask questions and my wife asked questions, the surgeon looked at me and said, she has to leave the room. I'm tired of this woman taking notes while I'm speaking. And I said, well, that's unfortunate because I need to have the notes. The reason we're both here is two brains are better than one. And she said, I don't care, she needs to get out of here. And I said, fine, I will never speak to you again, and I'm finding a new doctor. So that was that incident. So.
Are there any tricks that you use to prepare for an appointment that kind of helps you to remember what you need to ask the doctor or what you need to bring up?
Well, basically it's name, date of birth, and it's a list of medications. Primary care physician, cardiologist, orthopedist, electrophysiologist, all the doctors that you would have to see, which makes the process easier for whoever next you're going to see. And then I list surgeries that I've had, because that's one of the questions you get on the questionnaire all the time after that.
Makes sense.
That works for everybody.
Yeah.
I think if every senior got this list together with the meds and all the other stuff, they would find, in my opinion, that first encounter a little better. The complaint of being older is that they want everybody to use their computer. And if you're older now, you're not a computer person. You still want to use the phone. So I have a number of seniors that are 75 plus that need help even scheduling an appointment. And God help you if you have to go through the phone system, because they're all broken. There's so many menus, and usually the first message you have is, please listen carefully because our menu has changed. Right? So, and then there's 8 things, and if you're older, you're kind of saying, okay, this is 1. If I want to point 2 is if it's medicine. So that whole system is rigged, in my opinion, against the senior citizen.
Mm-hmm. Not good. Also, one more question I have.
Sure.
Personally.
Sure.
For a person who's looking to go into the medical field, or someone who's currently in or just out of medical school, would you have anything to say to them to kind of keep in mind or consider as they kind of bloom into a fully fledged doctor about dealing with senior patients in a respectful and effective manner?
Fight the system and treat them as humans, because you're gonna be there one day.